when you need my voice. I'm here when you need my voice. I'm here when you need my voice.
So now let us take up the next topic, that is preventive pediatrics. Why would you study preventive pediatrics, beta? What's the rationale of studying preventive pediatrics? I think we have had a lot of discussion in just the previous modules. You already know that if you talk about the under 5 deaths, the major share of the under 5 deaths, that is taken by the infant mortality rates. Out of infant mortality rates, whatever is the infant mortality rate, major share is taken by the neonatal mortality rate. And out of that, you already know that major share up to 50% is taken within 0 to 2 days, and remaining 2 to 7 days takes another share. So out of the total under 5 deaths, major share is taken by 0 to 2 days, and that's why we have this topic of preventive pediatrics, because at the end of the day, we want a healthy child. To have a healthy child, you should have prevention of diseases at a very early stage. That is what is preventive pediatrics. In this topic of preventive pediatrics, we shall broadly be categorizing into 3 main areas. The first area will be dealing with the care of the newborn and the child. The second area will talk about the breastfeeding. And in the third section, which will be another video module, we'll talk about the malnutrition indicators and the growth charts. So if you talk about the early newborn care, in early newborn care, we will discuss a lot of things, but just to sensitize you, there are something called as delivery huts. In delivery huts, these are simple delivery points. The person who will be conducting the delivery, they also have been trained for the early neonatal care. We also have something called as the newborn care corners. So every delivery point will have a newborn care corner. This will be studied under the heading of facility-based newborn care later in your modules. So at all the delivery points, at all the labor rooms, at least we have a newborn care corner. In early newborn care, we check what? We check for A, B, C, D, and E. So we check for the Upgar score. That is immediate, you do Upgar scoring for the child, and then you are supposed to check for the airways. In very early care, I'm talking of a public health system, I'm talking of a community level system where we teach the health workers of how to do early newborn care. So we do the Upgar scoring, airways, then we check for B. B will stand for the body. B stands for the body. In body, you are going to check 2 things. We are going to check for the body temperature and the body of the child, that is any congenital anomalies, specifically talking about imperforate anus or anything like that. And C stands for the cord care. C stands for the cord care of the cord. D stands for the dermis care. Dermis is the skin care. So we need to talk about the skin care, and E is the eye care or the ophthalmic care of the immediate care of the newborn child. So if you talk about the Upgar scoring, I think you'll be doing much more in detail in pediatrics. So I'm just showing you a very brief outlook, like how does the Upgar scorecard look like. If the score is between 0 to 3, that is called as very severe or very poor score. 4 to 6 is moderate, and a normal score is always more than 7. In fact, for most of the children, it should be around 9 or 10. That is what is the Upgar score. So we do scoring in 0, 1, and 2. We take into account the heart rate, the respiratory rate, muscle tone, reflex, and the color of the baby. So that was regarding the Upgar scoring. Next is, if you talk about the airways should be clear. Body temperature. The body temperature should be maintained, because what is the most common cause of death in very early stages within 24 hours or 24 to 48 hours? Please note, it is hypothermia. Hypothermia is a very important cause of death, and that is loss of body temperature. What is the reason for hypothermia? Please note that it is loss of heat, specifically from the major portion from the head. There is a concept called as a warm chain. What do you mean by a warm chain? Warm chain, please note it is cold chain for vaccines, okay? For warm chain, as the baby comes out of the vaginal canal of the mother, so the baby should be covered, the baby should be wrapped so as to prevent any heat loss. After wrapping the baby, you will check the weight of the baby. If in case the weighing scale is there nearby, of course, without the cover, you check the weight, again you wrap the baby and you give it to the mother. This process of having the baby, covering the baby, checking weight, and again covering the baby and handing to the mother for a warmth of the mother to the baby, this is called as warm chain. It is to maintain the body temperature of the child. To maintain the body temperature of the child, we have a warm chain. So in body temperature, you need to study about the warm chain. Then is cord care. The cord should be very clean and nothing should be applied. As far as dermis is concerned, please note that the guidelines say that the bathing of the baby should be done, at least should be deferred at least till the body temperature stabilizes. It stabilizes with the outside temperature. It comes in harmony with the outside temperature, because it's not usually Tamil Nadu or Kerala all the time. There could be areas like Siachen Glacier where the children are born. There could be areas like Leh Ladakh, Manipur, Meghalaya where the children are born. So the temperature might be very cold out there. So the body temperature has to stabilize with the environment, and only then the bathing should be done. It should be at least avoided for the first 24 hours. It is usually avoided. For the first 24 hours after life, the bathing should be avoided. Then is eye care. As far as the eye care is concerned, beta, just one MCQ. Earlier for eye care, we used to put silver nitrate and any ointment, something like that. Please note, the current guideline says that eyes needs to be wiped simply from inside to outside. Simply wiping of eyes as the baby is born. Wiping of the eyes with clean water or normal saline is sufficient to clean the eyes. Next is if we talk about the weight of the child. The average weight of a child in India is ranging from 2.8 to 3 kilograms. 2.8 to 3 kilograms. Average weight in India is 2.8. But yes, in urban areas, the average weight has increased to 3 kilograms. When do we call a low birth weight? Please note that we call a low birth weight if the weight is less than 2500 grams. That is called as a low birth weight. Talking about weight, the weight should ideally be measured. Weight should be checked within first day. The weight should be checked within first day. Talking about the height or the length. The length should be checked within 0 to 3 days, and the head circumference should also be checked within 0 to 3 days. But the weight should be checked within 0 to 1 day. Ideally, the weight of the baby, that is what is called as the birth weight. So the weight should be checked within 0 to 1 day. Next is this concept of topic number 3. What is this concept of what do we call as at-risk children? So how do you identify at-risk children? The at-risk children are identified by various parameters. So either if the weight of the baby born is less than 70th percentile, if the body weight is less than 2500 grams, that is of course at-risk baby. In case there is no weight gain for consecutive 3 months, that is also at-risk baby. In case the child is having protein energy malnutrition or there is a persistent diarrhea, that is at risk. Birth order more than 5, twins or triplets or quadruplets, any number is at risk baby. And very important, a lot of times this has been asked, that working mother, if the mother is working, that is also at risk, and if there is a single parent, that is also at risk baby. So another MCQ which has been asked is about the birth order. Please note that birth order 3 or 4 is not considered as at risk. At risk baby is birth order 5. These have been your previously asked MCQs. You need to make sure that you know them, that how do you define at risk baby. Talking about this point number 4, a little bit more in detail about the low birth weight. You already know that what is low birth weight. Low birth weight is less than 2500 grams. Let us say that this baby is born, this baby is low birth weight. Now, bache, if this baby is low birth weight, what is the reason that this baby is low birth weight? Either this baby was born before the term. So in medical words, you can say that this baby was a premature baby, and that's the reason that this baby had a low birth weight. Or the baby was born at term, or it could be premature also, whatever age, but that baby was small for the gestational age, whatever age the baby is born, the baby could not even achieve that particular height at that age. So in very gross words, we can say that IUGR is a major determinant of small for gestational age. So there could be two reasons. In a country setting like India, IUGR forms a major determinant of the low birth weight. So what is the formula for low birth weight? Low birth weight can be given by a formula that it is the total number of low birth weight babies in the area divided by the total live births multiplied by 100. It is expressed as percentage. It is always expressed as percentage, and the current prevalence of low birth weight by different researchers has been given to be around, I'm not saying it's a single answer, it's around 22% prevalence is the prevalence of low birth weight in India. So IUGR forms a major determinant of low birth weight. So talking about what is preterm. Preterm baby is a baby who is born less than 37 weeks. Or in case if we are talking in terms of the days, it is less than 259 days. What is a term baby and what is a post-term baby? The post-term baby is a baby who's born after 42 weeks of gestation, or if the baby is more than 294 days. Okay, that was my address. So 294 is easy for me to remember. So with a baby which is more than 294 days. What is the term baby? Term baby is 37 to 42 weeks of gestational age, or which is from 259 till 293 days. You can remember it this way, that is what is called as a term baby. Talking a little bit more about the preterm could further be classified into extremely preterm, or it could be a very preterm, or it could be a moderate preterm. Extremely preterm is a baby who's less than 28 weeks, even who is less than 28 weeks of gestation, and then is 28 till 32, and then you have 32 till 37 weeks of gestation. That is what is moderate preterm. So these are the types of preterm babies, and prematurity is one of an important determinant, but more important than that in India is intrauterine, and coupled intrauterine growth retardation coupled with the prematurity is a massively big problem. That is what India is facing as far as the low birth weight babies are concerned. Next in line is point number 5. If you talk about what do we mean by KMC. KMC stands for a kangaroo mother care. What do you mean by a kangaroo mother care? Bache, in kangaroo mother care, the mother is supposed to hug the baby and give a tight hug, not very tight, that the skin of the baby is in contact with the skin of the mother. So that will give a lot of bonding, emotional bonding between the mother and the child. So what are the elements of kangaroo mother care? What are the advantages of kangaroo mother care? Kangaroo mother care is going to help in SANE. You can remember it as SANE, SANE. The mother will help in skin to skin touch. This will promote what? It is going to maintain the body temperature of the baby. Body temperature. Then there is ambulatory support. Then this skin to skin touch will also help the baby to have a nutritional support. That is more breastfeeding, and of course the skin to skin touch or the kangaroo mother care is going to increase the emotional support or the emotional bonding of the child to the mother. So that is what is the elements of the KMC, kangaroo mother care. Point number 6 is you should know what do we mean by rooming in. So a lot of different new words might be there. What do you mean by rooming in? Rooming in means having the baby very close to the mother just after delivery, just immediately after delivery. Rooming in, having the baby very close to mother. Immediately. It should be immediately after delivery. After delivery. It actually promotes so many things. It actually promotes the mother to do breastfeeding very early. It removes the anxiety of the mother that how my baby is looking, what is all that. So it also removes the anxiety of the newborn baby that they are very close to the mother. So that is what is the advantage of rooming in. Please note that rooming in is not that the mother should be put into a private ward or any general ward. It is simple rooming in of the baby to the near, very close to the mother, not adjacent. It should be very close to the mother. That is what is rooming in. And moving over to point number 7, which is in fact a big topic, that is questions from breastfeeding. Questions from breastfeeding. Please note, I think it's imperative for everyone to understand why do we do breastfeeding? Why does a mother do immediate breastfeeding or very early breastfeeding? It is because the breast milk is very safe. It is the most economical, right? It's the very economical food that the child can have. It is very safe. It is the most clean and the hygienic food. And of course, common sense, breastfeeding is like one of the most nutritious food for the child, nutritious food for the growth and development of the child. So that's just like simple common sense advantages of the breastfeed. And of course, I think we all know that breastfeeding from the mother, it secretes oxytocin in the mother, and oxytocin is a hormone which attaches more, which gives that more sense of emotional bonding with the child. So it also promotes emotional bonding of the child, and it removes the mother anxiety and the child anxiety. So these are just some of the advantages of breastfeeding which you think may be asked in your exam. Question number 2 regarding breastfeeding. What do you mean by a colostrum and what is a mature milk? What is colostrum? Colostrum is the milk which is secreted in the first 0 to 3 days of life. Colostrum is rich in what? I think we all know it is very nutritious. It is rich in what? Proteins. It is rich in which protein if the question asks? It is rich in the immunoglobulins. Which immunoglobulin? IgGs and IgA. If you get a single best answer, please mark it is rich in immunoglobulin A. So that is the advantage of colostrum. Next is, what is this mature milk? Mature milk is a complete diet. Mature milk is a complete diet. So when does a female start having a mature milk? Please note, it is not after the colostrums. It is after around 12 to 14 days of life of the child. So after 12 to 14 days, we say that the mother's milk is a mature milk. So what happens after the colostrum? Usually first 2-3 days is colostrum, and after 2 weeks it is mature milk. So from 3-4 days till 2 weeks, it is called as a transitional milk. No MCQ on transitional milk. You just need to know that transitional milk is something there. Why? Because the MCQ can be asked that when does a mother have mature milk? Don't answer after 3 days. Mature milk is after 12 to 14 days. It is a complete diet for the child. Question number 3 on breastfeeding which can be asked is, what do you mean by a foremilk? And what do we mean by a hind milk? So foremilk and hind milk is there in every feed from the mother. The foremilk is there and the hind milk. What do you mean by the foremilk? The foremilk is the first milk. The foremilk is the first milk. F for foremilk, first milk, and this hind milk is the subsequent milk. Subsequent milk which is secreted from the mother's breast for the feeding the baby in every feed. So what do you think? The foremilk is a watery or it is more fatty? Please note that the first milk is foremilk and it is always more watery. When a guest comes to our home, we give them what? the food first or the water? We always give them, serve the water first. So the first milk, that God has also made the same mechanism. The first milk that is being given to the child is usually watery. It is to quench the thirst. It is to quench the thirst of the child. That is, the child was crying for food or for feed, and the God has made a mechanism that first should be the watery system, and then there is a hind milk, which is a subsequent milk. It is more fatty, and it is to provide the energy to the child. It is to satisfy the hunger of the child, or satiety of the child is taken care by. Satiety of the child will be taken care by the hind milk, right? So these are a couple of questions that you may get. Question number 4, still on breastfeeding. When do we advise the mother to do breastfeeding? Please note, it is usually 2 hourly. The breast milk is usually given as 2 hourly. It is always with burping. That is, the child should be taken to the shoulder of the mother, and the back should be always massaged so that the child may burp. So that's kind of a mechanism by which we ensure that the milk is there in the stomach and not only in the upper part. So 2 hourly with burping, and usually the feeds should be 6 to 8 times, at least 6 to 8 times a day. They should be more than 6 to 8 times a day. So coming to this point number 5, the MCQs may be asked even for something for the artificial feed. Artificial feed. What if the mother did not have the breast milk, or the breast was not okay for the breast milk, or the child lost, unfortunately, the mother? In those cases, we have to rely on the artificial feed. If you talk about the principles of the artificial feed regarding the energy, it is usually said that it should be approximately 100 kilocalories per kg per day. So this actually relates to that the milk, if we are giving the diluted milk, it should be roughly, approximately, it is 150 ml of milk per kg per day is what is sufficient for a child to give that much amount of energy. So that is how the milk is there. This milk could be, if it is diluted with the cow's milk, or it could be, we are talking of the human milk or the breast milk. If you talk about the protein should be 2 grams per kg per day, which roughly correspond to 13 to 15 grams of protein per day for a child whose age is less than 1 year. Carbohydrate should be 10 grams per kg per day. See, the milk should be undiluted after 4 months. Okay, so before 4 months, it should be a diluted milk. So what do you think is the best milk with which you should dilute? So if you are giving a baby a cow's milk, please note, cow's milk, it has 3 times more protein. It has 3 times more protein. So the cow's milk is usually given as 1:3 dilution. 1 part of the cow's milk and 3 parts of water, because the main problem is that the baby's kidney is very small. In detail, we have discussed during our chapter in nutrition, but just to sensitize you over here, the baby's kidney is very small. We don't want to overload, have a excess protein for the baby. The energy still can be taken care of, but the cow's milk should always be 1:3 parts dilution, because we are taking care of the protein of the child. The feeding should always, as always, should be 6 to 8 times a day, or when the baby demands. That is what is the principles of artificial feed. So now coming to the last point about some of the acts or legislations which may be associated with breastfeeding or evaluation of breastfeeding in India. So first is regarding evaluation or some of the legislations which are available. We are going to talk on that. So first is, what is BFHI? BFHI beta stands for the Baby Friendly Hospital Initiative. It stands for Baby Friendly Hospital Initiative. Baby Friendly Hospital Initiative was started by the United Nations, that is the UNICEF. They started the Baby Friendly Hospital Initiative, and there are actually 10 points which a health facility should be adhering to. Now, for a country setting like India, it is very difficult for a CHC or a government health facility to adhere to all those 10 points, to be having a BFHI accreditation. In private, it may be possible. In a government system, we do not have that possibility. So the government of India, they planned for having their own BFHI. So in one is BFHI. One thing you talked about is BFHI, that is Baby Friendly Hospital Initiative. Please note that it is a United Nations scheme or a agenda, that is Baby Friendly Hospital Initiative. India, they launched their own BFHI, that is MA. What is MA? MA stands for Mothers Absolute Affection. MA stands for Mother's Absolute Affection. What is the guideline under the MA? So the MA guidelines are that the baby who's born in India should have breastfeeding at least within 1 hour if it was a normal vaginal delivery. In case of normal vaginal delivery, the breastfeeding should start within how much time? Should start within 1 hour. In case of a cesarean section, the breastfeeding should be started at least within 4 hours. Please note that I hope in gynae also you are studying the same values. In gynae, many times the FOGSI guidelines are that the breastfeeding should at least be started within 30 minutes. We duly respect that and we duly regard that, but in MA guidelines, it is 1 hour. So if you get a question that as per the government of India or as per the National Program for Mother and Child Health Care or RCH program, any program they name. So if they say something related to the government of India, that means they are asking community medicine. Community medicine is 1 hour. So please note that the breastfeeding in India should be at least started within 1 hour. In case of normal vaginal delivery, in case of cesarean section, it may take up till 4 hours for the breastfeeding to start. Next is under MA guidelines only, there should always be exclusive breastfeed. What is exclusive breastfeed? What is exclusive breastfeed? Please note that the exclusive breastfeed means exclusive. That means no water, no dal ka pani, no chawal pani, no rice water, no peanut water, no soups, nothing extra, no water also for 6 months. For 6 months, it should be only breast milk. So why do you think that the country India says that only breast milk for the first 6 months of life for the baby? Why do you think the child cannot digest the outside food? Answer is no. It's not about digestion. It's not about anything else. It's always and always about infection. So please note that I wrote the advantages of breastfeeding. The first and the most advantageous of breastfeeding is it is economical, it is freely available, and it is the most hygienic thing we can have in India. So it is to stop infections. Breastfeeding, exclusive breastfeed, the main funda is to stop infections or to prevent infections in India. That is what is the use of exclusive breastfeed. So all these are your MA guidelines. The third legislation which may be associated with breastfeeding in India is the IYC Act or the IMS Act. So this the full name of the act is Infant Milk Substitutes Feeding Bottles. It's a whole paragraph name, Feeding Bottles and Infant Food Regulation. So that's the whole name of the act. It was started in year 1992 in India. It was later amended. Amendment was made in 2000, again in 2004. So right now we are following it is fondly like the whole name, it's a very long name. This is called as the Infant Milk Substitute Act. So the IMS Act has been amended in year 2004. What is the main focus or the main forte of this IMS Act that you need to remember for your questions or your exams? Please know that under this act, the agencies or the organizations, they have been prohibited. There is a ban. There is prohibition. Prohibition of what? There is prohibition for publicity or for advertisements. advertisements of the infant feeding substitutes, milk substitutes products. So earlier you might be seeing a lot of ads about Cerelac or Nestle or things like this, right? So a lot of infant milk substitutes advertisements were there in TV, on radio, even there used to see a lot of posters. So now under this IMS Act, it has all been prohibited. It cannot be it's not about the sale is prohibited. The sale is still there because people who need it, they can buy it. But the promotion and the activities are banned under this IMS Act. And so with that, I think we are almost over with this module. Just to very quickly summarize what you have learned in this video section is we talked about the early neonatal care, where we talked about the A, B, C, D, and E. That is the Upgar scoring, the airways, the body temperature, the cord care, the dermis care or the skin care, and the eye care. We also talked about what are at-risk infants that you need to remember by heart, that the at-risk infants are those infants which is birth order more than 5, working mothers is there, low birth weight less than 2500, less than 70 percentage of the expected weight. All these are at-risk babies. Then we talked about the height and weight. Please note that the height should be measured within 3 days. The weight should be measured within 1 day. Talking about the low birth weight, we already studied that the low birth weight could either be due to prematurity, it could be due to IUGR. IUGR is more important determinant for causing low birth weight in India, right? But of course, it can be coupled with both, that is IUGR along with prematurity. It could be both things together also. So low birth weight is a big headache in India and it's a big problem. We also talked about what are term infants, what are preterm infants, and what are post-term. Please remember, preterm is less than 37 weeks, post-term is after 42 weeks. 37 to 42 weeks is called as term infant. If it is less than 37 weeks, less than 28 weeks is called as extremely preterm. 28 to 32 is called as very preterm, and 32 to 37 is called as a moderately preterm baby. So that was about the low birth weight. Then we discussed about the breastfeeding guidelines. Please note what is the difference between a colostrum and a mature milk. The timeline you need to remember: mature milk after 14 days, colostrum first 3 days. And then you should know what is a hind milk and what is a fore milk. We also talked about the IMS Act. We talked about the MA guidelines. That is, the breastfeeding should be exclusively done for 6 months, and the breastfeeding should be started within 1 hour of delivery. Immediately, in case it's a normal vaginal delivery. In case it is a cesarean section, it should be done at least within 4 hours. So with that, we close this module. Thank you so much. See you in the next one. Bye-bye.
Hi guys, please subscribe my channels.